our patient here obviously does not have PID, looking at it from the scan. That's me, Sonia Yuzi. Wait, why am I not smiling? Okay. So we're talking about PID in this video, pelvic inflammatory disease. So the reason why I'm talking about it, because out of 100% of the patients that come into the ultrasound unit, about 80% do have pelvic inflammatory disease. It's obvious that you can use an ultrasound scan to detect if a patient has pelvic inflammatory disease. We'll be checking a lady to know whether she has in this video. So pelvic inflammatory disease has to do with the inflammation, which is also known as the swelling of the reproductive system of a female. Like if you see how the fallopian tube just increased now, the inflammation because of some bacteria that had infected the female, it came from the vagina and went up to the uterus. But it doesn't mean that it can affect only female, it affects men too. Just that they don't have the uterus and the fallopian tube to increase, but there will be a disturbance in their own reproductive system. We have ways to prevent this pelvic inflammatory disease. We have the practicing of safe sex, getting tested for sexually transmitted infection. We have long-term complications of pelvic inflammatory disease. That's why I say it's good to always get treated early, tested early to make sure that you're free. Because some of these complications can be very dangerous, like the infertility, ectopic pregnancy, and chronic pelvic pain. But for now, let me just explain the symptoms of what one would see. This our patient here obviously does not have PID, looking at it from the scan, because there is no fluid in between her uterus. I don't know, you might not be able to see this, but if you go for an ultrasound scan and you check your results, you see PID, moderate fluid seen, like moderate fluid seen at the POD, that is the part of Douglas, then you know that okay, you have PID. You understand there's an inflammation. Before I forget, I said I was going to say some of the symptoms of this pelvic inflammatory disease. These symptoms include pain at the lower abdomen, also even at the upper abdomen. In fact, there will be usually pains. The waist, you will feel pain at the waist, even painful sex, painful urination sometimes, irregular menstrual cycle, and a long run can cause that. We can have fever, smelling, vagina, and discharge. Person also be tired. So, and aside the sharp pain, yeah. So, the treatment is, some people would ask if it's actually treatable. Yes, it's actually treatable. It's just that if it stays for a very long time, the harm that it has caused, the damage it has caused might not be reversible. So I hope you actually learned something. If you did, please remember to subscribe, like the video, and share to your loved ones. Thank you.